I'm Ashley Block. I'm a case manager here at GSHC Surrogacy Agency, and I'm here to talk about the gestational carrier process and timeline. So the next stage, embryo transfer process. Once you have legal clearance, that is given to the clinic by the attorneys, also by your case manager. Now, typically we can see about the calendar 1 to 2 weeks, depending on the clinic, how backed up they are at that time. Now, they are going to need to know where you are in your cycle, so your period, like when was the last one, if you're still on active birth control. They also need to know any blackout dates that you cannot travel for your transfer, dates that you will not be able to make early morning appointments, because all of your appointments during your calendar, they have to be done in the morning. If it's an issue, you have to definitely let your case manager know so that they can help you and advocate for you to get the changes made for you. The calendar for your embryo transfer is going to show dates for when you start medication, dates on when your monitoring appointments will be, and the date your possible transfer will be. Now, I say possible because things can change during your calendar. For your monitoring appointments, if you're in a different state than your clinic, your IVF clinic that you're seeing, you do not have to travel for each appointment. For your monitoring appointments, usually they are local. So your case manager will find a clinic near you so that you can travel there, so you're not having to constantly fly back and forth and missing a ton of work. Based off your contract, if you're within 55 miles of your IVF clinic, it's considered local. Medication management. It is extremely important to follow your medication protocol from the clinic. You need to be doing your medications every day, same time. You do not want to go past the 24 hours between injections because your medication will no longer be working for you. Your clinic will be checking your levels to make sure that you are doing your medication correctly. There are specific medications that you will take during your calendar. Most of them will be injections. Please do not hesitate to reach out to your case manager for instructions on how to do it. We have been through the process. We understand, and we can provide like videos, pictures on how and where to inject. It's extremely important to follow the calendar, to do exactly what the clinic says so that nothing comes back that you did something wrong. It also helps the clinic be able to change protocols if your body is not responding to the medication correctly. And that's why it's also important for you to go to your monitoring appointments. They can make sure your lining is thickening if you're on estrus, that your labs are coming back, that your progesterone is not high before you start progesterone injections. So those are some of the things that are very important during your calendar, following your medication protocol and attending your appointments when needed. How long am I on medications for? Do I stop? I'm like, no. Don't stop medications until the clinic tells you, but you will be on them until about 10 weeks of pregnancy. During your embryo transfer, no sex. You have to refrain from having sex. That's one of the biggest things that we find out. You're putting so many hormones into your body. It's so easy for you to get pregnant on your own. So we say refrain from having sex during that time because you don't want to get pregnant yourself. For transfer day, when it comes for travel arrangements, we will help you with that. So whether it be flights, hotel, anything that you need. If you are traveling for your embryo transfer, bring your medications. Yes, we highly recommend bringing a travel companion with you so that they can help you, because now those transfer days are considered princess days. You need to be treated as if you're already pregnant. So bringing somebody with you to help you get through the airports or drive you back home, anything like that to help you throughout the whole process is something we highly recommend. The clinic recommends as well. Day of transfer, recommend wearing some comfy clothes, just going in, feeling very relaxed. It's very, very important that you show up to the clinic full bladder, no caffeine. Highly recommend no caffeine that morning. Just some water, a healthy breakfast. Show up. Depending on the clinic's protocol, they'll tell you when to show up. So it can either be an hour before, 30 minutes, 15 minutes, just depends. They are going to thaw the embryo day of transfer. So it's important to make your transfer time on time, because if you are late, the embryo can only last for so long that same day. After embryo transfer, you will get to go back to your hotel, and it's extremely important to rest. Recommend a warm food, keeping your abdomen nice and warm, does help, and it's just important. Do not go around walking, don't go to amusement parks, nothing like that. It's extremely important to rest. Rest is the biggest thing. Plenty of fluids, recommend those as well. If you are traveling home same day, please have someone to drive you. We do not want you driving home. If you're flying out or driving home the next day, perfect, that's okay. But we, like I said, just have someone with you would be the best option. Pregnancy confirmation. First blood test is typically anywhere from 8 to 12 days after embryo transfer is done. It's just to check your hormone level to make sure you are pregnant. Once we have the results and you are pregnant via blood test, they will redo another test within 48 hours to double check that it is going up. If your levels are continuing to rise and your medication like progesterone, estrus look great, you can expect to have a first OB scan. So this is a heartbeat confirmation, typically 2 weeks from your first blood test. Depends on the clinic. Sometimes they'll do it a little bit sooner just to check placement of baby, but they would like to do it 2 weeks after because you're around 6 weeks around that time. It's when they can check the baby's heartbeat. But on average, 8 to 12 days after after embryo transfer is your first blood draw, 48 hours after to check the levels are rising, and then a first heartbeat confirmation 2 weeks from your first blood test. OB care. So once you have done all your monitoring appointments, everything looks great with your pregnancy, around 10 to 12 weeks of pregnancy, the IVF is going to release you to your OB. This is when you need to share your OB information with your case manager, let them know who you're going to be seeing, your delivery hospital where you plan to deliver. We also have to make sure that you're going to get a specific testing done within a certain time frame. So before 14 weeks, you have to have your NT scan and an NIPT lab test done. These are very important, especially for intended parents. They like to know if anything has happened. Yes, the embryos are tested, but from the day of testing and to when they implant at embryo transfer to up to 14 weeks, a lot can change. Things can develop. We have seen it happen. So those tests are extremely important for your OB. Obviously, you're going to see your OB once a month, every like 4 to 6 weeks, depending on the doctor. So you'll do those, and those appointments can typically be pretty quick. You know, we always ask for an OB visit summary, something that we can update your intended parents. They need to be checking your BMI, blood pressure, if they can check baby's heart rate each time. Anything that needs to be updated to the intended parent. You will also be seeing a specialist for like anatomy scans, fetal echo. You will probably have more ultrasounds done during this process. So like fetal growth, you'll see your doctor until 36 weeks. Then you start doing like every 2 weeks and then like once a week, NSTs. But we're here to hold your hand during that entire thing.